All right, so on the program this morning, we are mirroring midwives as unsung heroes for cancer care and maternal health in Nigeria. All right, Michelle Mongongolo is a nursing service manager with Midwives Cancer Center, and she's joining me on the program. Madam, it's nice to have you join us. Good morning.
Good morning to you. Good morning to you. And thank you so much for having me. I'm happy to be here. All
right.
Thank you.
Okay. So I had some little problems pronouncing your name. Maybe for better clarity, you can just pronounce that for our listeners. Let them get a better clear of what that name sounds like.
It's okay. It's okay. In any case, my name Mangongolo.
Okay. Mangongolo. Which part of town are you from?
South Africa.
Oh, great. So it's nice to have you join us on the program this morning. All right.
Thank you very much.
Great.
Happy to be here.
Okay, so yesterday the whole world focused attention on midwives and nurses as we marked International Day of the Midwives. So who are those we refer to as midwives and what roles do they play in the health sector? Talk to me.
Yes, thank you very much for this question. This is wonderful. Okay, midwives are the one while every baby is coming to this world or every person at the interest of the world, you find a midwife. Thank you very much.
Okay, so midwives, I know that they are also very much involved in caring for babies, bringing life to the world. They help to deliver women who are pregnant and, give care to pregnant women. So how is that sector? How is it faring? Talk to me.
It's a very nice, noble job, noble career. We are very, if I can say, proud to be the first people receiving people in this world. And on the other end, if we do, let's say, for instance, cancer care, like what we do here, mainly in the Midwives Cancer Center. So if, let's say, we are doing palliative care, we are just there. You find a nurse when the baby is coming, and you find also a nurse when somebody is kind of exiting this world.
Right.
So that's why it's a noble career. It's not just a job, it's a calling.
All right. I love the fact that you said it's a calling, and you have been in this sector for 22 years. How's it been for you? I mean, I'm sure there must be times when we say these are ups and these are downs for you as a nurse specialized in cancer care. Is that correct?
Very correct. Thank you very much for this wonderful question. I would want to say that our work is deeply emotional in cancer care. Why? Because we receive the patient from the one when they come for their treatment. So then they keep coming for their sessions, and then you just begin to realize that the chemotherapy stops working. Then they begin to progress, and before you know it, they are admitted to the ward, and then one day they are gone. So it touches you, and it makes you cry, and it's okay to cry. There's a room for that.
All right.
But then you still think and remember that you have got other 20 patients and family members looking at you, waiting for you to stand there for them tomorrow. So you don't give up. You understand? So you stand, and you just need to know what can make you feel again better for you to stand for the others. So like in my case, as you have asked me, I will pray, asking God for strength and faith and the courage to stand again. We can't give up. As I said, it's not a job, it's a calling. You have to love what you're doing. You have to stand for somebody. They need us, and we need them, because it's kind of when they say you've got cancer, some people think it's a death sentence,
right?
But they need people like us to stand in the gaps for them. Thank you.
So what you do is quite different for what the ordinary nurse would do then. I mean, if you're going to be caring for people who feel their future is uncertain, who feel have hit the end of the road, that means you must possess some extra qualities. So how do you handle that kind of situation when you have patients that come in, some of them are probably at stage 4, some at the levels that they never understand that they're coming down with cancer and the like. So what kind of mannerisms? What kind of character? How do you handle that kind of a situation?
Okay, thank you very much for that wonderful question. First of all, the work that you do is very crucial, number one. So we are there for information, we are there for education, and we are also there for support. So when they come, they will receive that bad news. They need to cry, let them cry. It's normal. Let them reject the bitterness that they have. And then they will discuss with their doctor. Doctor will tell them about the cancer and the treatment modality and the side effect, what to expect. Also the stage of the disease. So when they come to us, the nurses, very, very crucial. We understand that these people need holistic care. Not only look at the cancer that they have, you look at the whole human being, because that person is an emotional being, that person is not only physical being, that person is a spiritual being, psychosocial being.
Right.
So you look onto all those ones, and you know that cancer treatment are very expensive, so you also give that information and education, maybe to direct the people to some places where they can be helped with raising funds for the treatment. As we know, people are paying out of the pocket. So when they come to us, number one, they are in denial. Everyone is going to be in denial. Like, God forbid, where did I get this one from?
Right.
In my family, there's no this, and this. Am I going to survive it? So they need someone to speak into them and to sit with them, let them kind of accept the journey, because they need to be part of the treatment. They are entitled to information. Give them the information. That is, do not hide information from the patient. Tell them.
Right.
They are, when they come to you, they are scared. Fear of the cancer and fear of the treatment. Some of the people, they don't even know what chemotherapy is.
And
Nurse
Mitchell, I mean, if I'm going to interrupt you, for a moment, what drove you to this? I mean, at what point did you decide that I'm not just going to be a regular nurse, I'm going to be a nurse that will be caring for cancer patients?
Wonderful question. All my life I've been a midwife. All my life. So as I said, proud of receiving baby, the first person to kind of accommodate someone coming into the world. Then, so from I believe 2010, I just thought I should change the direction. Instead of being a midwife, I want to be a palliative nurse. So, because it's something I always want to as I said, it's a calling, it's not a job. If you are able to do what you're doing, you're going to enjoy while doing it. So I shifted, and I want to show the cancer part of it. So it's kind of the beginning and the end. Thank you.
Okay. All right. So now that you've been there, you've been specialized in cancer care. Does it matter the type of cancers, or is it all cancers that you attend to?
All cancers.
All cancers.
Yeah.
All right. Okay, then. So since we're talking about the International Day of Midwives, have you had a situation whereby you've had to even deliver patients that are also coming down with cancer?
Say it again. Come again with that question.
Since we're talking about the International Day of Midwives, have you had a situation whereby you've seen any patient that is pregnant and you have to deliver the patient as well that has cancer?
Okay, it's good like that when you change the field, really, you want to focus on what you are doing now. You want to focus on okay, so I just wanted to say it's not only midwives, International Day of the Midwife, it's the Nurses, International Nurses Week.
Okay.
From the 5th to the 5th. So all of us are in there.
Okay.
Midwifery, cancer, every nurse is in there, because we are the backbone of the healthcare system. So to answer your question, saying that I can still deliver a baby, yes, because it's part of me. It is in me. It's part of my career. It's part of my calling. So right. I can do both, but I've decided to focus.
Yes, I know you can. I know you can still do that. But I'm asking, have you seen a situation whereby a patient that's someone who is down with cancer is also pregnant and has to be delivered of a baby? Have you seen that situation before?
Yes, they come. First of all, before treatment, you need to make sure that they are not pregnant because you understand chemo or radiotherapy can affect that baby. We don't want that. So we make sure it's a mandatory factor. Before you initiate your treatment, you have to go for pregnancy testing. We make sure that you are not pregnant.
All right.
But there are times that patient came there already pregnant, and let's say the second trimester of their pregnancy, there are chemos that cannot cross the placenta membrane to go to the fetus, so they can still receive their chemo in the second trimester and third trimester and give birth to babies that are healthy, and you understand. We call them chemotherapy babies, but not for radiotherapy. You cannot jump on the machine while you are pregnant. But on chemo, you can sit on the chemo. If you are, let's say, from 28 weeks pregnancy, you can receive your chemo. Yeah.
All right. So since you are a specialist in care for, as in a specialist nurse in care for cancer patients, do we have many of you around?
Many of you mean the specialists in like in Nigeria here?
Yes.
No, unfortunately.
Okay.
But we are adding to that. We want everybody to be trained. We are trying to put all the measures in place for the nurses to enjoy oncology, go for training, so that you can all be certified and standing with upper end and standing for the patient.
All right, then Lagos Traffic Radio 96.1 FM. Message here says, hello, I'm just wondering, why don't we hear much about midwives unless it's childbirth? Sadiq is sending that one in from Ili-Ekpo. Well, that's what they do. That's their calling, Sadiq. They are called midwives for the special purpose of caring for maternal health and childbirth as well. This one says, good morning, Victor. I remember when my wife gave birth, when my wife gave birth, the midwife helped a lot. Are they trained for more serious conditions too? This is Tunde sending that one in. All right, so Michelle, this will go to you. Are midwives, are they trained for more serious conditions as asked by Tunde in this question?
Definitely, yes. That's the reason why they are called midwives. So they've been prepared, they've been trained to deliver different cases. It can be bridge, it can be transverse, it can be cephalic. So we all know, if for instance, if you cannot deliver that baby,
okay,
then the patient will have to go for theater, for C-section, or otherwise you can. There's a way you maneuver to tell that. Let's see if the baby is bridge. You just make sure how to turn and maneuver. You need to be a midwife to understand the language I'm using, so that you can rotate that kid and bring from the buttocks the baby will see come out. You have to be not just ordinary nurse. You have to be a specialist. You have to go for midwife to know all those techniques.
All right,
Thank you.
Another message here says, good morning, Mr. Victor. Why is it that midwives are not talked about as much as doctors? You didn't put your name, but thank you so much. Well, I wouldn't be able to say that, but Nurse Mitchell, what do you think? This person is asking, why is it that midwives are not talked much about like doctors?
Thank you very much for that question. I think you have to recommend yourself first, because when, like the title of this week, it says our nurses, our future. So they include everybody there that said me. So midwives are also there. We see what we do. The doctor cannot come and do the job alone. We need everybody. This is a multidisciplinary approach. The midwife is playing a key role, important. Those are the ones that have been with that patient from the antenatal consultation up until the day of delivery. So we are so much, we are important. But now, if there's no one to promote us, we have to promote ourselves. This is the reason why I'm proud to be on this station, is to promote what you're doing. So if nobody is there to promote you, promote yourself.
Okay,
promote,
which is very, very good. This one says, good morning, ma. I'm a bit confused. What is the real difference between a nurse and a midwife? Bolanle is sending this one in from Ikeja. Bolanle, thank you so much. So what's the major difference?
We are different. Thank you very much for your question. There are different categories of nurses. They are just, we have got registered nurses. They are just registered nurses. They are just, the sense, yeah. But there's this double qualification of the midwife. Midwife is taking care of pregnant women from day one until they deliver. That's a midwife. A normal nurse can be in a general ward, can be a surgical ward, can do everything. But before you become a midwife, you are first a general nurse. Then you go for is a specialty. You just go to the edge. You can go for pediatric. You can go for oncology. You can go for midwifery. Thank you.
All right, then flash update from the control room says there's a breakdown of a Sino truck loaded with cement having mechanical problem. This is at Megida inwards Ayobo. It's awaiting the arrival of a mechanic. All right, we have traffic managers on ground doing the needful within that end, but presently things are still looking very, very good. Let's begin to wrap this all up. So let me say happy International Day for Midwives and Nurses. And as we do this, what's your message to the listening public this morning, especially for those who are in special care for cancer patients?
Okay, thank you very much. What I want to say, let me start with the cancer first, then I'll come to the others. Encouraging people to join the career is a noble one. As I said, first of all, on the cancer part of it, awareness is key. Everybody needs to know about cancer, and everybody, you need to know your body so that when you begin to see unusual things, you don't need to ignore it and go for routine checkup. Very, very important. Let's say if there's cancer in the family, it's good for other people to go for genetic test so that you can, you remain vigilant, because the earlier the best.
All right.
So if, let's say, they discover the cancer very early, and there are more chances for the cancer to be brought into remission. For the other nurses or nursing part of the ward, I just say we see your sacrifice. Sometimes you work till very late, or maybe you have got the ratio nurse to patient is, instead of you having 4 patients at a time or 5 patients, you are having maybe more than 10. We see your sacrifice. You are the backbone of the case. Do not give up. Stand firm. Continue to be good. Continue to be the light to the healthcare system. Continue to be the backbone of the health system. And, the blessing is yet to come.
All right.
Thank you very much.
We'll leave it at that for now. Madam, it's nice having you on the program, and I can see you are very, very proud of your profession. All right. Thank you so much for connecting with us on the program this morning.
Thank you very much for having me. Thank you.
Then. All right. So we've been mirroring midwives as unsung heroes for cancer care and maternal health in Nigeria. And I can tell you, Michelle Mongogolo, who is a nursing services manager with MedServ Youth Cancer Center, has taken us on that excursion. A brief break. When we return, we'll do our birthdays before we switch gears to maritime today.